Welcome to the Intensive Care Nursery at the Children's Hospital at Dartmouth. We've made this video for families of babies who are patients here in the ICN. We want you to understand more about us and the care we deliver to your baby.
Yes, anesthesia will figure that out without you having to worry about it, because they are pros. That's their job to work on it.
You may feel overwhelmed at first with all of the people and activity and equipment, but those first impressions will change. You will soon find that you can be comfortable here in spite of all of the activity, so you and your new baby can get to know each other and shape those important family bonds. As you become familiar with the ICN and the things that go on here, remember that your natural parenting instincts will be your best guide. Trust them.
Well, I think you are afraid at first, and you have to understand that that's a normal part of what to expect when you come to the ICN. That initial visit to your child is scary.
When you first see your child, it's going to be shocking to see, leads and tubes and breathers and things, and then within a day, you're not going to see any of that.
Yeah,
it will become invisible to you.
Where you have concerns and questions, be sure to talk to any member of the ICN staff.
What range should she be in to be staying where she is, and what range?
You're really anxious at first. It's very nerve-wracking experience and stressful. And the only way to help alleviate that stress is to make sure that you understand everything that's happening. And asking questions and educating yourself, I feel, are the best ways to at least lessen that stress.
We're all very straightforward here. We don't hide anything. If parents have questions, we answer them. If we can't answer them, we get the attending or the resident to come over. We talk about what the situation is, the gravity of the situation, the possible outcomes of the situation.
They would often stay around and talk to us. The nurse practitioner has been off for an hour, but she's still there, explaining something to you or just making sure you're okay with it.
ICN stands for Intensive Care Nursery. You've probably heard of ICUs, which are intensive care units for adults who have complicated medical or surgical problems. The Intensive Care Nursery is the same kind of place, but especially for infants. Some of our babies are born here because Dartmouth-Hitchcock at Lebanon is their home hospital, or because the mother's local physician has referred the mother to us before delivery, knowing she or the baby may need specialized care that her home hospital can't provide. Some babies may be transported to DHMC in an ambulance or helicopter by a special transport team. Our intensive care nursery receives babies from all over New Hampshire and eastern Vermont.
Hi. How are you? Get it all set up?
The Children's Hospital at Dartmouth is best known as CHAD. It's part of the Dartmouth-Hitchcock Medical Center. The ICN is located at our Lebanon campus. We want you to be with your baby as often as you'd like. Each time you come to the nursery, we'll ask you and your visitors to stop at the reception desk so you can help us ensure the safety of your baby and other babies as well. There may be times when we ask you to wait while certain procedures are completed. There is a waiting room near the nursery. Once per day, the staff will ask you some general questions about your health. We want to be sure you're not sick when you enter the nursery. Anyone with cold or flu symptoms, other than parents, must wait until they are feeling better to visit the ICN. If someone has been recently exposed to the chickenpox, notify the ICN staff. This virus is extremely dangerous to these infants, and visiting may be restricted to protect the babies.
Okay, scrub up to your elbows.
Family members and friends other than parents can visit too, if they are accompanied by the parents, or if parents have placed the visitors' names on a special visitor list. Of course, this means healthy brothers and sisters are welcome. They usually do best with short visits. Please limit visitors to 2 or 3 at a time. Bear in mind that from 11 at night until 5 in the morning, you will need to use the emergency room entrance since all other doors to the medical center are locked for security. Remember, you're welcome anytime. The last thing you want to do is put your baby or any other baby at risk.
Our population of infants have a very weakened immune system and are prone to catching infections easily. So, I mean, we have to encourage staff, family members, everybody to be diligent with hand hygiene because these little ones, they need to utilize all their energy and calories to growing as opposed to fighting infection.
When you first come into the nursery, the receptionist will take you over and go over the whole routine of every time you come in here, that you should, scrub up really well, make sure you take off any hand jewelry.
It is absolutely essential that anyone visiting the baby, parents included, wash their hands well each time they come into the nursery. There are sinks near the entry where you can wash for each visit, and there are bottles of Purell sterile cleanser placed throughout the ICN.
And we talked about before, this is a very safe surgery. It has a high chance of being successful.
There will be several people caring for your baby in the ICN. If there's anyone you haven't been introduced to, please ask who they are and what they do.
Absolutely.
Neonatologists are pediatricians who specialize in caring for newborns. The ICN has several neonatologists on staff who oversee the care of these infants. They have direct access to other pediatric specialists if your child needs surgery or has problems with his or her heart, digestive system, brain or nervous system, kidneys, bones, or blood. Some of the doctors you'll meet are fellows or residents, doctors who have graduated from medical school and are getting more training in different specialties. Nurse practitioners are nurses with advanced training in the care of newborns. Like medical residents, they are able to prescribe medicines and order tests and procedures. Respiratory care practitioners work with the doctors and nurses in helping babies with breathing problems. Registered nurses will care for your baby 24 hours a day. When your baby first arrives, your baby's nurse may only have your baby to care for. But usually, each staff nurse cares for from 2 to 4 babies. One primary nurse will be in charge of planning and overseeing your baby's complete nursing care.
We've been in the ICN for 3 weeks now, and we've really had 2 nurses that have worked with us throughout those 3 weeks. And they become your friend and when in stressful situations, and they know what you've gone through from the beginning.
Patient care technicians assist the nurses in caring for the babies. A registered and licensed ICN dietitian collaborates with the providers and staff to deliver the best nutrition to the babies. The lactation consultant is a nurse who has training and expertise in breastfeeding and in teaching how to use a breast pump. A clinical resource coordinator is a nurse who will be in charge of the discharge process for each baby. Behind the scenes, a clinical nurse specialist with advanced training in the care of children serves as a trainer and consultant to the nurses you'll meet at your baby's bedside. The ICN has a designated social worker who can help you develop plans to handle the emotional and financial stresses involved with having a baby who needs special care, and chaplains are on staff to offer spiritual support. That's a lot of people working on behalf of you and your baby.
All the different roles can be really confusing. But I just asked everyone. I kept asking, I may have met you already, but can you tell me again your name and your role, what you do for my daughters?
As parents, you are members of your baby's care team. Parents are included in rounds when many of your baby's care providers meet and move from bed to bed to discuss the condition of each infant.
I've really appreciated being involved in rounds.
Sophia, her weight today is 2020, which is up 40 grams, so she gets to have her shots today, as does Isabella.
That's been a really special thing here, is not only being able to attend rounds, but also being a participant in rounds. The doctor's asking me, how are your daughters doing today? What do you think are the health issues right now? And that's been really nice.
Getting comfortable in the ICN means understanding some of the hardware and electronics that surround you here. Special beds are used to keep the baby warm. An overhead warmer or an incubator may be used early on in your child's stay. The beds provide your baby with the extra warmth he or she needs and still let the staff observe your baby closely. As your baby becomes more stable or gains weight and doesn't need the extra warmth, he or she may be moved into a crib. Team members keep a close eye on your baby, but ICN babies are often connected to monitors that keep track of their heart rate, breathing, blood pressure, and oxygen saturation. These monitors can be noisy. Alarms sound often. You can be sure the nurses at the bedside know which alarms require action.
Once the babies get here and they are settled, we go over all the equipment and everything with them. A lot of beeps are just, giving us ranges in which, say, their oxygen levels are or what their heart rates are. But we have to reassure the parents a lot that what they're hearing isn't necessarily critical.
Parents are very good at knowing their babies. They are the monitors. I mean, you can have machinery, but a parent who's holding their baby and knows their baby knows better than anybody what's going on with their child.
Intravenous or IV pumps are used commonly here. Most babies have IVs to give them fluid and nourishment. Babies have several possible sites for the placement of IVs. During the first weeks of life, arteries or veins in the belly button can be used as sites for delivering fluids, for monitoring blood pressure, or to obtain samples of blood. Other IV sites include the arms, legs, and scalp. We use very small, flexible IV catheters that are placed in a vein just under the skin. Your baby may need a ventilator. This machine helps babies who have difficulty breathing. The ventilator is attached to a tube that goes to your baby's windpipe. When your baby no longer needs the ventilator, he or she will move on to continuous positive airway pressure, called CPAP. This delivers high-flow oxygen through tubes that go into the baby's nose. Having a baby in the ICN can be an unexpected and stressful time in the parent's and family's life, and you'll have lots of questions. Write your questions down so you can refer to them when you speak to us.
Everything that you say is valuable to them, and they really make you feel that way. So don't be intimidated by the doctors. Ask them questions, build relationships with them. They want to help you as much as they can while you're here. Build relationships with the nurses and any of the support staff, because it's going to help you get through this stressful time by having people that support you.
The time you spend with your child now is important. You are beginning a lifelong relationship with this little person. It's never too early for you to begin to get to know your baby, learning what he or she likes or doesn't like. Babies have subtle ways of communicating. Quiet, sleeping babies are contented babies. Restlessness may mean your baby is uncomfortable and stressed. The staff can help you explore ways to calm and soothe your baby. The more time you spend talking and playing with your baby, the better you will understand what brings comfort.
I think it's incredibly important to try and bond with your child as early as you possibly can. It's the one common thread in their care. It's been nice to have primary nurses that take care of them and have continuity of care with their nursing staff, but you are the common thread in their care, and so bonding with them early, they respond to you and you can see them improve.
Some babies are stable enough to be held soon after birth, and some babies can only be gently touched for a period of time before they're able to be held. There is a way of holding your baby that we refer to as skin-to-skin holding, or kangaroo care, where your baby's skin is in contact with your skin.
I would wear a gown and just take his clothes off except for his diaper. I would just leave my bra on, and he just goes, I would just hold him right to my chest for however long he'll tolerate it. His heart rate level drops, his oxygen level stays pretty stable. He doesn't do the swinging where his oxygen will go up and down a lot, and he just, as a mother, I guess I can just tell that he's very comfortable and very relaxed.
When you're doing the kangaroo care, you can see the baby's heart rates fall, the oxygen saturations go up, they sleep, they melt right into the parent's chest.
Parent bonding is #1 priority here.
Unlike full-term healthy babies, your child may be very sensitive to noise or touch.
You want your baby to hear your voice as much as possible and know that you're there for them. Even if you can't hold them, you can touch them. And at first you're nervous to touch them because of all the wires and everything going on. And sometimes you would touch them and the monitor would go off and you're like, I shouldn't have touched them. And then you realize it's okay. And the nurses help you a lot with that. They're like, it's okay to touch them.
Unfortunately, you're not always able to spend as much time with your baby as you'd like.
They may have other children at home. They may need to go back to work. So we try to assure the parents that we are taking care of their babies, that we're talking to their babies and holding them. Parents are more than welcome if they are not able to come into the unit to call. We tell them you can call once a day, twice a day, call in the middle of the night if you're unable to sleep and you're wondering how your baby's doing.
Most of your time at DHMC will be spent with your baby in the ICN. But it's important to take breaks, too.
You have to leave sometimes. Go get a bite to eat outside of the hospital's campus. Spend some time with your partner for an hour. Give yourself an hour where you just go with your partner somewhere and spend time with them.
In most seasons, parents and visitors can get out to explore the lawns, gardens, and walking trails that are right out the door. Indoors, you can visit the Chad Family Center, where big brothers and sisters can play with toys or read, and you can use the web and library, talk to other parents, and relax. The medical center has a chapel, a dining room and food court, a post office, a gift shop, and a pharmacy, along with other shops and services. David's house is another place you should know about. It is a home away from home on the hospital campus. Families of Chad patients can stay here while their child is in the ICN. You can find more information about David's house in your admission packet.
We are staying at David's house, and you have your own bedroom. It's a community kitchen, community bathrooms, and community washer and dryer rooms. They have dinners nightly that are sponsored by volunteers, and it's been a savior for my husband and I. It's $10 a night if you can afford it. If not, they don't require any money from you.
The length of time babies are in the ICN varies. Most babies go home well before their original due date, so don't wait to get things ready around the house. Many of the babies are only in the intensive care nursery for a few days. Your baby will be ready to go home from the ICN when he or she is taking all feedings by breast or bottle and is able to maintain his or her body temperature in an open crib. Your baby needs to be gaining weight, but there's no minimum weight for discharge. In a few situations, your baby may go home with a monitor. We may recommend that you spend a night with your baby in a special private room before the day of discharge. We call this rooming in.
We have a room called the Koala Suite, in which parents are able to stay in and sleep through the night with their baby. It is just off the unit, so the nurses are close by. It gives them a chance to sleep overnight with their baby and perhaps trial a monitor that they're going to be bringing home, and gives the parents a chance to gain confidence and, you know, be alone with their infant, yet knowing that we're close by.
Not all babies go directly home. When intensive care is no longer needed, some babies need to go to their home hospital to gain more weight, to learn how to breast or bottle feed, to continue to regulate their own body temperature, and learn to breathe on their own before they can go home with you. The ICN staff wants to help you and your baby in every way possible. It's important you have a thorough understanding of your baby's plan of care. So please ask questions, ask us to explain procedures, monitors, medicines, tubes, and IVs, anything that raises any question or piques your curiosity.
Our staff knows how to take care of the baby, but until the parents know how to take care of their baby, we haven't done our job. So really the family and the parents are number one part of the care team.
They listen to me, I know my child best, so they'll take my opinion to heart and really listen to what I have to say.
The fact that this hospital believes in like a family atmosphere, that we're allowed to participate in her care. I mean, we can feed her, we can change her. It's not all the nurses. You're more involved. You're more involved in your child's care, so your stress drops.
You don't feel like an outsider.
Right.
You have the time to spend with your families, and you do really bond with these people. You have their most precious gift in your hands, and you take good care of that gift.
Welcome to the Intensive Care Nursery at CHAD.